I was basically a victim of an experiment.
That's not good.
She was one of the original megastars of the adult film industry. At the height of her fame, Elizabeth Starr underwent a dangerous operation to increase her breasts to an O-sized cup.
So that is 47 inches.
Did he say O-sized? So her breasts are very, very large. The largest breast implant made is 800 cc's. Now you ask, of course, how do people get breasts larger than that? Well, what some people are doing today is they're taking implants that are 800 cc saline implants. But instead of filling it to 800 cc's of saline, they fill it to 1,000 cc's, 1,500 cc's, even 2,000 and more. Is that what she's had done?
The now banned string implant procedure had dire consequences, and despite 63 corrective surgeries, Elizabeth now lives every day in fear that she could die at any time.
She's had 63 surgeries on her breasts? That is crazy. They mentioned that she has string implants. These are implants that you probably have never heard of unless you've been watching my channel. String implants were originally developed by a plastic surgeon named Dr. Gerald Johnson, and he developed these as basically made of polypropylene string, and they looked essentially like yarn. And so you put the yarn essentially in people's breasts, and this polypropylene very slowly absorbs moisture or serum from the body, and it gradually expands. It can expand larger and larger and larger, and it does not actually stop expanding. As you can imagine, this can create enormous breasts, and we'll talk more about these crazy string implants as we watch this video.
In 1999, Elizabeth underwent a controversial procedure using synthetic string implants to stimulate fluids in her breasts, increasing them from an F to an O-sized cup.
These string implants were available in the 1990s for a very short period of time, and they were used mainly by adult film type actresses. Now, they were actually outlawed by the United States and in Europe in 2001. So they are not in general available anymore unless you get them on the black market or in another country that somehow allows them to be sold. Now, these were never FDA approved, so what she was saying earlier in this video, that it was essentially experimentation, it's actually true.
I was lied to, and I was told that it was approved by the FDA. Both my breasts were growing with fluid, getting bigger, larger.
The string procedure is now banned, but for Elizabeth, the effects of the operation were devastating.
You don't see a lot of women who have these string implants anymore. Possibly the most famous person who still has them is an adult film actress named Chelsea Charms. And take a look right up here. This is her Twitter page, and you can see her breasts are absolutely enormous, and she advertises them as the largest breasts in the world. Now, once again, these string implants will cause the breasts to keep getting bigger and bigger and bigger. And if they get to a certain size, they can literally pop, as crazy as that may sound. So the way to prevent them from getting so big is to take a needle and a syringe and literally suck the fluid out of the breasts every so often. I mean, it is a horrifying, horrifying thought.
A lot of us got sick, walking around months and months with staph infections in our body, eating away the breast tissue, killing us slowly.
With one string implant deeply embedded in her left breast and a saline implant in her right, she lives everyday fearing the next infection could be fatal.
So because her breast with a string implant will not stop growing, then she does have to routinely empty that fluid out. And every time you do essentially an invasive procedure, you introduce the risk of infection. Now you may be wondering, what happened to the doctor who performed this operation? Well, he is now deceased, but during his career, he did have his share of controversies. It was reported prior to his death that he was the plastic surgeon, or one of the plastic surgeons, for the late Anna Nicole Smith. And there were reports that he was at one time trying to sell her surgical photos for profit. So I never met this doctor. Once again, he's deceased now, but man, these string implants are absolutely horrifying.
And living with supersized breasts poses other challenges.
Sometimes I bump into walls because my boobs reach the walls or the corners before I do. I can't buy a bra off the rack. I have to have things custom made or altered.
Because her breasts are essentially filled with fluid, can you imagine how heavy they are? How much back pain she must have? One of the surgeries that's the most popular that I do is breast reduction surgery. And I do these surgeries on women who have breasts literally half her size. They've got grooves in their shoulders. They've got horrible back and neck and shoulder pain. So I really feel for her that she is probably quite uncomfortable.
I've seen cases of polypropylene string implants. I've never seen a case like this. Elizabeth's future is uncertain. I presented Elizabeth's case at the local medical society, and pretty much the unanimous sentiment was that she needed a double mastectomy.
So why would she need a double mastectomy? Well, these string implants, I've never actually seen one in a patient, but I would have to expect that they kind of grow into the breast tissues if they are absorbing the breast tissue fluid. Because of that, unlike, let's say, a saline implant where you can make an incision and just pull it out and then the implant's gone, you may have to actually cut the normal breast tissue out, and this could leave her with a major, major deformity. So it appears that she is stuck really between a rock and a hard place, unfortunately.
It's hard when you have been a victim of something. I was basically a victim of an experiment. I have one option. I honestly don't think that I could face getting a mastectomy and being reconstructed.
Back in the 70s and 80s, and less so in the 90s, but to an extent some there was essentially this experimentation early on in the age of breast implants, where doctors were injecting various substances into the breast to try to make the breast bigger. They were putting certain types of sponges into the breast to try to enhance the breasts. And when you really think about it, it is absolutely terrible what was going on with these poor women. The goal was to try to give them a cosmetic enhancement, but really at the expense of their health. Some of these substances, like the polypropylene string that was put into these breasts, were never meant to be used in this fashion. Now there is a lot more regulation with these types of things. And you can't just take a patient and put this type of a polypropylene string into them without certain ramifications.
Although choosing to live in fear over more risky surgery, Elizabeth hopes her story will act as a warning to others looking to extreme surgery.
If you're going to try to attempt to become as busty as I am, you are at an extreme risk. You have to know what you're dealing with because it will change your life forever.
I'm so glad that she shared her story because there are women out there who may not have string implants, but they have implant sizers that they actually fill themselves with saline, getting them breasts that are actually bigger than hers, believe it or not. And I react to a video right up here of a woman who does just that. Now, you may find it unbelievable, but it is actually true. Take a peek at the video right up here to watch her fascinating story. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.